Good morning, ladies and gentlemen, and welcome to this very special segment, Aapki Sehath, a very special presentation of Indian Medical Association of Australia and the Queensland chapter. Every month we bring to you some special topics. Remember that this episode goes to the air via Facebook Live on the first Saturday of every month at 10 a.m. and on the Sunday at 10 a.m. on Australian Indian Radio, the online radio, the only audio-only version on the radio can be heard on Sunday tomorrow at 10 a.m. once again. But right now, let's get on with this episode. And with that, I'd like to welcome to Lisa, who is going to explain to us about the association and also introduce us to the topic of this month. So, welcome, Lisa.
Indian Medical Association of Queensland has been running a public health lecture series since March 2020. Our members, who are doctors of Indian origin, practice in this wonderful sunshine state of Queensland. They volunteer their valuable time and expertise in this endeavour. The advice given by any doctor is of general nature and meant for information and education only. Please note this is no substitute for your own healthcare professional, and everyone is advised to consult with their own treating physician for ongoing health issues. I will now ask the Secretary General of the Indian Medical Association of Queensland, Dr Cyril Fernandez, to introduce you to our guest speaker of the month.
Hello listeners. Liz has already told you about the public health message of the Indian Medical Association of Queensland, Australia. Today we have the pleasure of welcoming and talking to and listening to Dr Sumer Phutela, who is a well-experienced general practitioner working in Queensland. He is a fellow of the Royal Australian College of General Practitioners. He is here to talk to us viewers on Aapki Sehath program, meaning Your Health, initiated by the Indian Medical Association of Queensland, Australia. Dr. Sumer, first of all, let me start with my first question. Can you please brief us on your background, educational, professional, and the achievements so far, please?
Thank you, Dr. Cyril, for this lovely introduction. I came to Australia in 2007. I graduated in 2006. I came here and I got through all my Australian Medical Council exams. I started working in the hospital. I've worked in quite a few hospitals throughout Queensland, starting from Nambour Hospital, Sunshine Coast. Then I've worked in Logan Hospital. I've worked in Green Slopes Hospital. I've also worked in a rural setting with Rockhampton Base Hospital. Then in 2010, I decided to move into a mainstream general practice. Then I got myself a position at Cambu Medical Centre, which is an Aboriginal medical centre in Ipswich. Yeah, I worked there for 3 years, and I was also doing some after-hours home visits during that time. I still do it, and I've worked a little bit, couple of years in Hatton Vale. I'm not sure if you know where Hatton Vale is. So it's a little rural, moving towards Toowoomba. I've worked there for a couple of years as well. I've recently joined Daisy Hill Surgery as a part of management, and I'm consulting here now at Daisy Hill Surgery.
And that's good to know what you told us viewers, Dr. Phutela. Look, GPs, general practitioners, are the gatekeepers of primary care, and GPs play a big role in preventive medicine and health, and also after-hours general practice, nursing home visits and aged care visits. Can you please highlight the salient features on aged care, nursing home, and after-hours deputizing general practice visits, please, Dr. Sumer?
Yeah, sure. Look, I've been doing after-hours for nearly 10 years now. I usually see patients around this area, so Logan, Crestmead, Marston, Beenleigh, Eagleby, this Daisy Hill, Sheller Park area. After hours, as you know, is after hours when the normal GP is closed and the patients are in emergency or they need to see a GP in after hours setting. That's when they call us. I work with National Home Doctor Service. So I I come across a variety of demographics, patients. So the aim of the after-hours service is to reduce the burden on emergency department. So we go to patients' home and nursing homes. We assess the patient and treat them if required at the time, and if we think that they need to be seen in emergency department or they are serious, then we refer them to emergency.
Look, Dr. Sumer, yeah, it's good to hear what you said about the after-hours practice, for our listeners' pleasure. Can you please give us a bit of idea on what kinds of presentations, like symptoms? What does people call you, for what kind of symptoms and diseases or presentation do you see in after-hours? Can you please tell us, Dr. Sumer?
Yeah, sure, Dr. Cyril. Look, we see a wide variety of patients around in after hours. It can range, the age group can range from day one day old kid to 99 in a nursing home. It can range from a mild flu-like symptoms where the young mothers, first-time mothers, are really, really worried and concerned. It can range from a severe abdominal pain to chest pains. I see a lot of chest pains that I have to identify and give them the emergency treatment required and refer them to the hospital.
Like a triage?
Yeah, look, if somebody I deem is got a chest pain, I have to give them GTN spray, I have to give them aspirin, call the ambulance, make sure the patient is safe till the ambulance arrives. And also, the best thing about this after-hours service is that there's a continuity of care. When I see a patient in after hours, I make notes, I assess them, my notes go to the regular GP in the morning, so there's a continuity of care. I advise the patient that it's important that you go see a regular GP in the morning so that there is a follow-up as well.
So there's a feedback to the GP, you advise them to see the regular GP, so in the interim the after hours takes over, and it's a good service. Thanks for highlighting on that.
Sure. Thank you.
You want to tell us a bit more on after hours before I shoot you another question, Dr. Sumer?
Look, I think after hours has been there for a long time now. I think a lot of people are aware of the service. After hours, there's a lot of services, but I work with the biggest one in Australia, which is 136 National Home Doctor Service.
136. Okay.
Yeah, I think the most important message here is, if you think there's an emergency to see a doctor, and you think that you can't wait for the after-hours doctor to come and assess the patient, call us. We work every day from 6 onwards, 6 p.m. on weekdays, Monday to Friday, Saturday from 12 p.m., Sunday all day, and all public holidays.
That's good. So rather than telehealth, the patients get an opportunity to have a face-to-face meeting with the experienced doctor, get an assessment, and things are not missed. Yeah, thank you for highlighting that.
Absolutely.
Dr. Sumer, see, some GPs have a special interest for certain areas in general practice, like they tend to have what's their interest in men's health, women's health, chronic diseases, diabetes, heart conditions, sexual health, osteoporosis. Please tell us what is, you said that you worked with the indigenous health center, Cambo Medical Center in Ipswich, So is indigenous health part of your special interest? Can you please tell us more about the indigenous health? We all know it's a very significant area in general practice. Please highlight on that, Dr. Sumer.
Absolutely, yeah. Look, my area of interest is indigenous health. I've seen a lot of indigenous patients in my general practice when I was working at Cambo. And as you are aware, that indigenous people have some complex chronic medical issues. The life expectancy, as you are aware of, indigenous Australian is way less than compared to a non-indigenous Australian. So what the government is trying here is to close the gap. So close the gap, they've taken a lot of initiatives in regards to building up new guidelines. So there are separate guidelines for a non-indigenous Australian, and there are separate guidelines for indigenous Australians. So the message here is identify and treat the indigenous population early to avoid all those complications.
And you have this special ATS, Aboriginal and Torres Strait Islander health assessment programs, linking with the practice nurse, and
Absolutely.
go through all different aspects, including immunization and the disease conditions, focusing on that what you mentioned. Sounds good. There is a good words that good knowledge for the listeners that you have given us. Dr. Samira, I might ask Liz to ask you a few other questions as well, you know.
Yes, Dr. Sumer, what are your hobbies and interests outside of being a GP?
Well, I was a really good cricket player in my old college days. Unfortunately, don't get much time these days to play full game of cricket. Yeah, I still like watching it though, you know. I like listening to some old Bollywood music. Part-time singer as well, you know, at times. But yeah, so spending some quality time with the family, I think, is very, very important. You know, after a stressful day at work, you want to go home and have some quality time with your kids, sit with them, listen to their whatever, you know, they've done throughout the day. I think that's the most relaxing for me as a GP as well, as a father, as a parent, and really like doing that.
Lovely. Dr. Sumer, finally, can you please tell our listeners, what is your message to maintaining a healthy lifestyle?
Well, see, Liz, nothing has changed in regards to healthy lifestyle. We still follow that food chart, you know, where we want people to have more fruits, more vegetables, and less of the fatty food, fried food, less of junk, less of takeaways. Regular exercise is very, very important. So we recommend, the college recommends that everybody should exercise at least 30 minutes, at least 5 days a week. And also, you know, quitting smoking is very, very important. Alcohol in moderation. So colleges set guidelines that there should be no more than 1 to 2 standard drinks per day, with at least 2 alcohol-free days in a week. This is basically the message, you know, regular exercise, eating healthy food, maintaining a healthy BMI around 25, and, you know, and seeing the GP. You know, some people I tend to see in my practice, they just come and say, I've not seen a GP, and they are like 45, 47-year-old, and they say, I've not seen a GP, you know, for a number of years. Maybe they're healthy. I'm not saying they're not healthy, but some people try to avoid going to the GP. If you have an issue, you want to talk to someone, we are here. We're here to talk to you.
That's great advice.
Yeah,
Thank you, Dr. Sumer. On behalf of the Indian Medical Association of Queensland, I would like to thank you for this wonderful presentation and your time today.
My pleasure.
Thank you.
Thank you.
Thank you, Lisa. And once again, that has been a very special presentation by Indian Medical Association of Australia's Queensland chapter, and especially brought to you by the efforts of Dr. Cyril Fernandez. And of course, every month we bring different topic, and what great conversation we had. You know, exercise at least 30 minutes a day for 5 days, and having 2 alcohol-free days per week. Some very good advice there from Dr. Sumer Phutela. Well, until next time, it's goodbye from me, and I'd like to place on record a very special thanks to IMIQ for, you know, providing this very informative session. So on Australian Indian Radio, we bring to you the real estate updates, the travel updates with Tanvi Goyal, migration migration updates with Suman Dua, and of course Indian Medical Association, you know, Queensland chapter bringing Aapka Sehath, meaning your health, 1 episode per month. And this episode goes to air on Facebook Live and YouTube channel on the first Saturday of every month, and first Sunday of every month it is aired on Australian Indian Radio, the online radio. So tomorrow you'll hear it on that channel. So once again, thank you so much for Dr. Cyril Fernandez and Dr. Sumer Phutela and Lisa for being on the show and presenting this wonderful episode this month. Until next time, it's goodbye from me. Enjoy the rest of the day and the weekend, and of course, remain safe.